Alrighty, it's about 3:32, so I'm going to get things started and do kind of opening announcements and such, and that way, as people trickle in, we'll be getting right into the meat of the panel, and that's what everyone's here to see anyway. So, hello, welcome, as always, happy Friday. Welcome to the Smart, Equitable Commonwealth, co-creating the society we want. My name is Dan O'Brien, and I'm the director of the Boston Area Research Initiative, or BARI, and this is our annual conference. And we are in the sixth week of the conference. And we have a really exciting discussion today. I'm really excited about it. It's about strengthening the Commonwealth through cross-municipal collaboration. Before I get to that, I just want to remind everybody that the podcasts for our first 5 panels are now available through Apple Podcasts, Google Play, Spotify, Stitcher, or SoundCloud. This is also where you will find all future podcasts as we release them every Friday. So be sure to subscribe. If you missed last week's, which was at a different time, it was at 11 a.m. To make the full panel work. It was a fantastic conversation between Paul Grogan and friends about innovation in Boston, past, present, and future. Some really great insights there from across sectors, moderated by Tiziana Deering of Radio Boston. So if you missed that, check out the podcast. Great conversation. A lot to be learned about the history of Boston and also the future. Now, turning to today, the idea of cross-municipal collaboration is really a topic that is near and dear to BARI's heart. The idea of cross-municipal learning and collaboration was the theme of last year's conference. And we continue to think that this is a really important effort on the horizon of urban informatics, smart cities, smart connected communities, what have you. And really this idea that we need to get beyond the implementation of data and technology driven innovations that enhance policy and practice only in central metropolises. And here in Greater Boston, I actually believe we're kind of one of the best positioned in the country as there's lots of really interesting and innovative work going on in multiple municipalities around the region, but there's still much to be done, and I think much of a model to be developed. And so I'm really excited to hear the talks today about the ways that this has been done and tested out by our panelists and their organizations. And I think, and this will come up in the discussion today, it's even more trenchant in this post-COVID environment where resources are going to be strapped. Tax revenues have gone down, and there's still going to be a need for innovation, as we've highlighted in every week so far. But the resources available to do that will have to be drawn on more creatively and collaboratively. So very much looking forward to how this panel can kind of help us chart that pathway forward. So with that, I want to, in a moment, turn over to our moderator, Ben Levine. He is the executive director of the MetroLab Network. For those who don't know of MetroLab, very important group, really valuable contributors in this space. They're a national consortium of 40 city university partnerships, of which BARI and our partner, Boston University's Initiative on Cities, are members in conjunction with the city of Boston. I can think of no better person to think about this subject, as Ben and his team interact with cities across the country every day, every week, and has a real bird's eye view of the way innovation is taking shape in cities and communities across the country. So I think this is going to be a fantastic conversation. And thank you, Ben, for joining us and leading us through here. Before I turn it over to Ben, the last thing I need to say, as I either do or don't remember to say every week, is we are active on Twitter. Please, if you have questions or comments or just want to highlight cool things you saw during the talk, at BARI Boston is our handle, and hashtag BARI 2020 is the hashtag for the conference. So please shoot things there. And we are also monitoring the Q&A. Anything that goes in those two channels is being monitored behind the scenes and will be brought to Ben's attention as we go through the conversation. But so with that, I want to turn it over to Ben.
Thank you, Dan. Really appreciate being here, and really appreciate the opportunity to participate in this event. BARI is such an important partnership for us at MetroLab, and I think what BARI has done is really exemplary in the region. And I particularly commend Dan and his team for turning this or rebooting this conference into something that's really exciting, and I think has created a lasting venue for for stakeholders that are involved in this space to engage as the COVID-19 crisis unfolds. I'm going to pretty quickly turn it over to my panelists, but just a word about the panel itself. I think this topic is particularly important because it sort of exists at the convergence of a number of issues that BARI and stakeholders, certainly on this call, are involved in very regularly, whether we're talking about civic innovation or academic partnerships or urban technology deployment. It intersects with a set of complex issues, maybe unique or in some ways unique to our country around federalism and deeply related to the history of the way that the country or regions were developed. I know that's particularly complicated in a place like Massachusetts. There's others on the call who understand the complexities of governance in Massachusetts more than I will, but I'm sure that some of those issues will be uncovered during this panel. So you'll be hearing from three panelists who are each going to be doing a presentation, and then we're going to shift to a moderated Q&A format. We'll be taking your questions, as Dan mentioned, both through Zoom and through Twitter, and look forward to engaging with you. So with that, I'll turn over to the first panelist, Emily Robbins, who is the Metro Bridge Program Manager at Boston University.
Hello. Hey, Ben, thank you for the introduction, and to BARI for inviting me to be part of this important conversation today. I am going to share my screen with you. It looks as though I may not be able to. Not sure if that's something maybe we can figure out in the meantime, but I'll go ahead and start with the presentation. So again, I'm Emily Robbins from Boston University's Initiative on Cities, where I lead the MetroBridge Experiential Learning Program. And so in keeping with this BARI theme of co-creating the society that we want, what I want to talk about today is how we can leverage experiential learning to bring together cities and university classrooms in a way that is helping local leaders address key issues, and at the same time also introducing students to the importance of being civically engaged in these communities. So what I want to touch on is three different topics. First, I want to use the MetroBridge model to explain how we connect students and faculty with local governments in Massachusetts to work on applied projects. Then I want to share some advice for both the academics and practitioners on the line that I hope will be helpful in terms of thinking about how you can replicate some of this work at your own institutions. And then lastly, I want to talk about how experiential learning, at least from our vantage point, has needed to pivot to meet these new demands of the COVID-19 crisis. Before I
Emily,
go on,
if I could just butt in for a second, I believe we have the screen sharing thing figured out. If you want to try again. Yes.
Let's go for it. 1 second. There we go. Can you guys see that? Good news is you didn't miss anything. Just the intro slide. So the MetroBridge approach to experiential learning through the MetroBridge program is really, again, all about embedding real projects for cities and towns into courses across the university. And we aim for a win-win approach where the local government partner receives tailored assistance on a topic that they identify as a priority, and students have the opportunity to work on a project that helps them better understand how they can contribute their skills and ideas to the civic process. So the first step in doing this work is that we meet with staff in mayors and town managers' offices, and also with program and department heads to understand their upcoming research and policy analysis needs. And then we serve in this matchmaker role to bring these ideas from the community to BU faculty, who either have an academic expertise in that particular issue area, or who maybe teach a class that aligns with the type of support the community is asking for. And if we have a good match, we work with that faculty member to develop a student project based on the research or policy request. And that faculty students will complete that work as part of their course. We also provide some support during the semester to help oversee things like project activities, and also to help students share their work with city or town partners. In the 2 years since we have launched the MetroBridge program, we've helped to create experiential learning projects in 24 courses with about a dozen local government partners and engaged with 325 students on these MetroBridge projects. And there are a few project examples that I think maybe best demonstrate this dual benefit of strengthening cities and also engaging students in community issues. The first is that we recently had students in an urban anthropology course start to do ethnographic research on how immigrant women feel about their access to public health services. We also had a social work class on mental health policy develop a plan for how health officials and first responders can support individuals who are experiencing hoarding behavior. And then we also had students in a cross-cultural psychology course explore ways that a town can create some new approaches for multilingual engagement with residents. So that is sort of a very fast, very high level overview of the MetroBridge program. And now what I want to transition into is some advice for how you all can leverage experiential learning, whether you are a practitioner or a professor. So, in all fairness, to do experiential learning on a larger scale like MetroBridge, you do need to have a support structure of dedicated people in place at a university to lead and coordinate this work. And I realize that not every institution has that as a resource, but I do really believe that with the right set of tools, individual faculty and individual city staffers can seek out these mutually beneficial opportunities to do this on their own. So here I've just outlined a few things to consider, whether you're a practitioner or a professor. So diving in, if you are a practitioner, one thing first and foremost for you to really consider is that your local universities are a resource for expertise, and not just in their policy programs and not just in their city planning programs. There is a wealth of knowledge in so many different departments and disciplines that may not seem obvious at first, but when you dig a little bit deeper, you can see the direct connections to informing program and policy decisions at the local government level. If you want to approach a university partner, try to have a very specific request or a very specific research question, if possible. And you can think about using some of the following phrases as a guide. What do my residents think about XYZ? What are the best practices for fill in the blank? What are my community's needs around pick a topic? So those are some things that can sort of guide your thinking around your request and your research question. I also would suggest keeping in mind the university semester calendar. Most classes start either in September or January, and faculty need a bit of time to update their syllabus to accommodate a new project. So it's probably best to think about reaching out about 6 months before you want to start working together. Another consideration is that the best types of projects to ask for help with are ones that maybe aren't super urgent, aren't really high stakes. And that's because you don't want to be setting up the faculty and students for failure. I think a better fit might be asking for help understanding emerging issues or collecting data to make decisions for future budget years, or to complement a strategic planning process that might already be underway. And then finally, and maybe most importantly, make sure that there's someone within city or town hall that can be a point person throughout the semester to answer questions that faculty and students might have about how they can best meet your project needs. So on the flip side, if you are listening into this and you are a professor, think about reviewing your courses and your syllabi for assignments that can be applied to a real world client. So if your students are already doing things like lit reviews, developing surveys, analyzing data, ask yourself if these are assignments that could be useful if they were applied in a real context instead of a hypothetical one. And research methods courses are particularly a good fit for experiential learning. This next one may seem like an obvious one, but track the local news. and think about, do you have research expertise or teach a class related to a policy area that's being considered? And then I would also suggest that if you're interested in partnering with a particular community, read that mayor's State of the City speech. Those are usually delivered every January or February. And this will help you get a sense of the local priorities and if there's been any new initiatives that are being announced that might align with your work or maybe with what you teach. I would also suggest keeping in mind local government budget cycles. The 2 to 3 months before a new budget is passed, which I think in Massachusetts is most often July 1, that's a really busy time. So if you are reaching out to try to start a conversation, if you reach out in April or May, you may not get a response right away. And then just as a final point for professors, don't be hesitant to start the conversation. A city or town might not know that you need help until you offer it. And local governments may not have the time or the bandwidth to think through project ideas on their own. So knowing that you can help them and what you can help them with is a really great way to start a partnership. And then lastly, what I wanted to talk about briefly is, how the COVID-19 crisis has impacted experiential learning. For the sake of time, I think I'll save some of this for the Q&A because I'm also really interested to hear what my co-panelists think about this. But what I really wanted to drive home is just this point that experiential learning is really more important now than ever. As many of you know, local governments in our state are planning really serious budget cuts and also layoffs and furloughs. And they're going to need this extra support and capacity from students at universities all across Boston to make sure that projects keep moving forward. And then also thinking about our students, they've also been facing challenges in terms of canceled internships or part-time jobs that they've relied on not only for income, but also as resume builders. So it's really critical for us as a university to be thinking about other ways that we're providing students with opportunities to gain applied experience. That's all I have for now. I'll hand it back to Ben, and I look forward to the Q&A. Thank you.
Thank you, Emily. And I know we will cover a lot of those topics related to COVID-19 during the Q&A. Next, we're going to hear from Mike Ward, who's the director of the Edward J. Collins Jr. Center for Public Management at UMass Boston. Michael.
All right. Thank you, Ben. Thank you, Dan. Thank you, co-panelists and everyone giving up some of their Friday afternoon here. I appreciate the opportunity to talk to you. I'm going to divide my time here between two things. One, the nominal topic, and let me pull up so I can get screen share going. There you go. Does that work? Can people see this?
Yes.
Great. So I've spent about half my time on the top listed topic, which is the impact of aging populations on municipal EMS costs in Massachusetts. And I want to spend about half my time on other topics because I think the overarching topic of the panel, cross-municipal collaboration, is something that we at the center actually have done a lot of and have a lot to say of beyond our specific topic. Before I get into both of those, just a very quick overview of what the Collins Center is and who we are. We were created by the Commonwealth in 2008 to provide technical assistance to cities, towns, school districts, regional governments, state agencies, et cetera, on all aspects of public management. You can think of us a little bit like a management consulting organization that has a public service mission. In our 12 years, we've done over 700 projects, mostly municipal, mostly Massachusetts, but those other types of entities as well. And we've also done a little bit of work in the other New England states. With regard to Massachusetts itself, we've worked in over 2/3 of the 351 cities and towns, everything from the largest, Boston, Cambridge, Lowell, Worcester, all the way down to just finishing up a couple of projects in Gosnold, which has 75 people, approximately the same number as the people on this call right now, or on this this conference. Our primary areas of work: municipal finance, including capital planning, financial forecasting, financial policies. In HR, we do a lot of personnel policy audits and assessments, HR operational reviews, compensation classification studies. We do operational studies at the departmental level and municipality-wide. We do a ton of work on org structure, including charter review and revision and charter writing. Analytics, executive recruitment, IT management, runs quite a gamut. We have a mix of generalists at the center and then subject matter experts. And the subject matter experts are usually retirees, municipal retirees from their field. So it's a blend of folks that make our project teams. So to talk a little bit about the main listed topic here, which is some research that we are finishing up. It's not yet published, but soon, on the impact of aging populations on municipal EMS. We're awaiting some final feedback from municipal officials and fire chiefs. So obviously, which is in the current crisis, taking a bit longer but we totally understand it. The work is a collaboration between our center and the Gerontology Institute, which are both in the McCormick Graduate School of Policy and Global Studies at UMass Boston, as well as the Lincoln Institute of Land Policy. And while the work we've done has been focusing on Massachusetts, from our conversations, it seems pretty broadly applicable across the other New England states. The research question that drove us and will hopefully drive us to some follow-up research once this one is done is, how are aging populations going to impact municipal EMS service provision and finances? So I'll give you just a couple of very quick high-level findings. First, here will not be surprising to folks that Massachusetts has an aging population. Older residents, that's 65 and older, and then within that, the subset 80 and over, are a growing share of many municipalities, particularly in certain regional pockets of Massachusetts, but pretty much everywhere. And I think the key preliminary finding, also sort of intuitive, but I think important for us to put some research behind, is that older users are heavier and different users of EMS than the general population. So you combine that heavier use and different use with a rapidly growing aging population, and you've got an EMS system both locally and then statewide that's going to be really strained. And the impacts on that service-wise are going to include things like increases challenges in training, challenges in morale, in the time it takes for EMS to reach the sites. So there's going to be a lot of service implications that need to be dealt with, but that's at the same time going to be coupled with some significant financial challenges. In particular, the sort of crux of that issue revolves around how Medicare reimbursement does not cover the full cost of an EMS transport, and then there are a lot of services that doesn't cover anything of. And so as those types of services go up, it's going to have a financial impact on municipalities as well. The other sort of general takeaway is that Massachusetts and the Northeast is behind a lot of other regions in trying some innovative approaches to deal with this, which I can talk about more in the Q&A. Just two charts to quickly to highlight the issues here. The first chart shows you there's 3 bars for those just listening. The bottom bar shows that the Massachusetts population in 2016, 15% was 65 and over, and that was accounted for 39% of the emergency calls that led to transports. And if you break that down even further, 4% of the population was over 80, and that led to 20% of the emergency transports. So if you combine that again with a growing population in those age brackets, you get the next chart, which shows that while the projected level of calls for service and EMS transports are approximately stable among those under 65 for the next 15 years, they go up significantly for those over 65 and then within that over 80. And that's really the crux of the problem that we're trying to start to call some attention to. How this connects to some cross-municipal collaboration? Well, fire and EMS are long-standing areas of collaboration through what's called mutual aid, which is, those of you can see the map if you can, I'll just describe it to you. It shows you the Commonwealth of Massachusetts, and virtually every city or town, save for maybe 5% of them, have signed on to mutual aid and are available to provide that to neighboring communities or other communities as needed. But mutual aid only works as long as there's capacity in the system. So if EMS demand increases statewide, particularly at certain times of day, days of the week, certain types of challenges, certain regions, that can at some point is going to overwhelm the whole system. And so there's some significant challenges ahead, as it relates to this EMS provision. At the same time, if we're talking cross-municipal collaboration, there's also opportunities for regional solutions, and some of the solutions that municipalities individually have been toying with, things like social workers to deal with the frequent flyer challenge of some EMS calls, nurse practitioners to deal with certain types of situations, as well as potential partnerships with urgent care clinics, which right now are cut out because ambulances can only transport to emergency departments. And so there needs to be some work done at the state level. You can get a waiver to do it, but it's a pretty hard process to be able to transport to urgent care. But there's opportunities there for I think, significant collaboration. So I want to just take a couple minutes from the rest of my time. I'm going to skip over this slide, which has a sampling of the center's work in regionalization and the different types of work we've done, because I want to just make some observations generally about what we call regionalization, but what under the panel here, cross-municipal collaboration. One thing that is interesting is that regionalization is, the old joke goes, is the wave of the future, and has been for a long time and probably will continue to be for a long time. On my desk, I have a stack about a foot high of reports, regionalization reports over the last 40 years, which sound very similar to each other. It is something that has long been pushed as a policy solution, but is way harder than it's often realized. This also often leads to the question of, well, what about counties and the other regional governments, the RPAs, the COGs, regional planning agencies, councils of government, other regional entities throughout the Commonwealth? Well, as many of you know, most county functions were dissolved in the 90s. There's only a couple left with any residual function. Regional planning agencies and the COGs, some of them do phenomenal work and provide some regional and shared services to their municipalities, but there's a lot of room for other potential there. And so this interesting, problem around regionalization, where there was a structure called counties. They were gotten rid of for legitimate reasons, but at the same time, everyone talks about how to regionalize more. It's a fascinating sort of statewide policy challenge. In terms of barriers to collaboration and service sharing in particular, there are many. I just picked a half dozen or so of my particular favorites, starting with org structure, which is I guess a pet issue of mine. When we talk about municipalities, we sort of view them often as coherent single entities with a single vision, when in reality there are so many competing interests within them, and the smaller the municipality, the more elected boards, committees, officials there are in Massachusetts, and each of those with their own power base, and it makes it incredibly hard to move forward on service sharing when you've got all these different elected boards saying, I don't have to do that, you can't make me do that, I'm just gonna, I don't think it makes sense, and so we're not going to do it. So that's a huge challenge. On the financial side, people often cite collaboration, service sharing, regionalization as a financial win, which it can be, but oftentimes it can provide a better service for the same amount of money. And unfortunately, in the environment we're in, that's not necessarily what people want to hear, but it often is the way it ends up. And the other interesting twist to financial is that even when there can be potentially big savings, they're not going to come in the current budget year. So if you're facing a fiscal crisis, the solution of regionalization is not really going to help you now. It might help you 2 years from now, 3 years from now, but that tends to put a damper on people's interest in doing it. Then there are operational challenges, getting systems to work together, getting people to work together. There's collective bargaining issues, untangling seniority if you're trying to merge functions of two like departments. There's political and cultural challenges. Amazing stories about municipalities that won't cooperate because they're the Thanksgiving Day football rival, things like that. And then there's this, it's sort of a variation, I guess, of the wrong pocket problem, where the people who might benefit from a shared service are less likely to see it or really feel it. And the people who are going to pay, whether that's in costs or jobs or something else, are going to see it and feel it first generally, and are therefore going to oppose it before the stronger than the people who might be pushing it are going to push the other way. There's lots more, but those are just a few, I think, of the big ones that we see in this work. Notwithstanding all that, there are definitely some success stories. Bigger cities providing services to small towns, things like inspectional services, even public health. There are towns that share staff and resources across a wide variety of functions. And then there are regionally delivered services. The ones that are growing there are regional dispatches are growing at a decent clip in Massachusetts. And then, of course, the largest and maybe most complicated example of that are the regional school districts. A couple quick points. Obviously the pandemic is on everyone's minds. How do we see cross-municipal collaboration affected by the pandemic? Well, it's been heartening to observe the incredible amount of sharing and borrowing of ideas, both formally and informally, between municipal leaders. We've seen and heard stories of just people really helping or banding together and helping each other out even more than usual. Increased dialogue about how to solve common problems. And then the last thing, going back to my previous slide a little bit, there is going to be now, because of the impending budget challenges, which could be anywhere from hard to extremely devastating. There's going to be more pushing to share services and to regionalize, but unfortunately, all the same problems that I've talked about before remain. The crisis hasn't really gotten rid of most of them. So I'm sure there'll be more we can discuss in this, and I'm happy to answer questions in the Q&A, but I will pass it off now to the next panelist. Thank you all for your time, and my contact information is there. Love to hear from you. Thanks.
Thanks, Mike. Next, we're going to hear from Min Ma, who is a consultant with MXM Consulting.
I'm going to try to share my screen. Okay, can you see it? Yeah. All right. Hi, everyone. My name is Min Ma, and I'm with MXM Consulting. And today I'm going to share with you a bit more of a specific example of how one community health coalition in Greater Boston is building cross-municipal collaboration around racial equity and mental health, and how we are evaluating the program. So a little bit about myself and the partnership. First, we are a design strategy and evaluation firm working with social sector agencies, mostly nonprofits in the Greater Boston area, though we do also have a bit of an international portfolio working in development. Our focus areas include youth development, employment, community health, refugee and immigration issues, as well as human trafficking. The coalition I'll be talking about today is Community Health Network Area 17. We call it CHNA 17. And it's a community health coalition serving 6 towns right outside of Boston: Arlington, Belmont, Cambridge, Somerville, Waltham, and Watertown. And in recent years, its focus has been specifically on racial equity and mental health. And this is based on community health needs assessments and other research that the coalition has done, and really saw that as an emerging and important issue to address.
So we have MXM Consulting and Channel 17 have a collaborative evaluation project where we work side by side throughout the year to review data and think about how to improve coalition strategy along the way. So a little bit more about Channel 17 before I get into the evaluation piece. The coalition works towards its mission by fostering learning and networking among its members. And kind of like a high-level summary of how it does this is through grant making, which I'll talk about a bit about in a moment, through providing reciprocal learning opportunities, which I'll also speak about, and then to elevate innovative and best practices in these areas through convening community forums and disseminating these through its newsletter and case studies. And so since our panel is about cross-municipal collaboration, I'll speak a little bit about some of the specific ways the coalition is building collaboration across sectors and municipalities. One way has been in its grant making by encouraging targeted partnerships through its grant. And so one example on the first bullet there, in the past year, it has issued a number of planning and implementation grants to address community-specific issues related to mental health and racial equity. And the coalition invited applicants to propose non-traditional, what it's referring to as non-traditional partnerships that can change how business is done in addressing this issue. And so applicants were encouraged to engage people with working on social determinants of health from various perspectives and bridge gaps between lived experiences and service systems. So one partnership I'll give as an example that emerged from this is a grant that was given to the City of Cambridge and Kingdom Empowerment Center, where they are working together now to centralize the importance of mental health and normalize seeking help for mental health issues, and then to connect faith communities in Cambridge to mental health service providers. And so this work is starting in Black faith communities in Cambridge, and then they're hoping to expand this beyond that. So that's one example. Another is in the learning communities that the coalition convenes. It brings together periodically every few weeks grantees and other coalition members to share in their successes and challenges in this work. And so it's really an opportunity to share ideas with one another and troubleshoot. And so we've had participation from the diversity, equity, and inclusion coordinators of several of the cities and towns covered by Channel 17, and have heard positive feedback about how the learning communities offer critical peer support in working on these issues, especially where some of these roles have been newly created in recent years. And so there's a lot of peer support in navigating that. And I'd say this applies beyond city agencies, also in for nonprofit organizations and their representatives who wear multiple hats and have to really work hard to create the space and the buy-in for internal conversations about racial equity. So how are we evaluating this work? We have, in the evaluation plan, we use a number of methods to look at outcomes, as well as the process for coalition building. And so what I wanted to share with you today is about how we're using social network analysis to better understand the process and how the coalition is growing. So social network analysis is based in network science, and at its core looks at how connected members are to one another. And applied to evaluation, we can use it to measure the strength of connections between members, the positioning of organizations within the network, how resources are leveraged, as well as the quality and impact of exchanges between members. So just like a very simple, if you aren't familiar with a network map, the nodes, the circles are representing people or organizations or actors within the coalition. And then the edges or the lines connecting them are the relationships. So China 17, we launched their social network analysis in 2018, 2 years ago, and conducted a network survey among its active members. So I'm going to share some of the resulting maps and how the coalition is using them to better understand what's happening and make decisions. So in 2018, we mapped 71 agencies and 248 connections between them. This map shows coalition representation by city and town, each with its own color, as you can see in the key. You'll see that some cities and towns are better represented within the coalition. And so when we first sat down to look at this with the coalition steering committee, it kind of helped us think about where they needed to conduct better outreach or engagement. The size of the nodes on this map indicates the agencies that have, the larger the nodes, the more connections they have with other members in the coalition. And that kind of indicates potential starting points for deepening coalition engagement. This next map looks at collaboration between agencies. So in red, you see the public health departments. In pink, you see hospital and community health providers, and in blue, you see community-based organizations. The size of the nodes is the same, and then this map adds a dimension that looks at the frequency of collaboration on the topic area we're interested in, which is mental health and racial equity. And so the darker and redder the line, the more frequent the collaborations are happening. And so these are all reported by members of the coalition. And we find that almost a third of them are collaborating at least once a month, or at least were back when we collected this in 2018. And then we also found from the survey that about 15% of these collaborations were developed because of the coalition, while about a third, 32% of the relationships were not developed through China 17, but have been strengthened or deepened because of their involvement in the coalition. And then just to share quickly some other maps that we've looked at connections with, specifically with mental health service providers. 24%, about a quarter, are of these coalition members are mental health service providers. And then we've looked at level of collaboration between them, looking at the dark pink lines are integrated partnerships in which organizations share funding. Green indicates coordinated relationships where they coordinate activities, and then light gray are collaborative relationships that are lighter collaborations that are about sharing information or sharing funding opportunities. So we're just about to finish analyzing a second round of data, of survey data from this, and are going to use that as an opportunity to look at how things have changed over the past few years, to see if the coalition has been successful in deepening engagement. We would hope to see deeper levels of collaboration or more frequent collaboration among agencies around racial equity and mental health, and possibly more connections. So I'll stop there and answer any questions in the Q&A. Thank you.
Excellent, thank you, Min. Great, well, we're gonna transition to a bit of a discussion. I know that we have about 15 minutes left in this session, and I understand this is transitioning to a happy hour, so I suppose we'll have maybe an opportunity to extend some of these themes into the happy hour to the extent that they're acceptable topics after 4:30 on a Friday afternoon. I would ask the panelists if they could try to be brief in their responses, just so we can try to get through some questions, give an opportunity for the audience to submit questions as well. So as a reminder, you can include questions through the Q&A feature or through Twitter using the hashtag BARI2020. I wanted to start with a question, I think, for Emily and Mike about, I think you both talk about how you basically run different types of institutions that channel expertise to local governments in different forms, one using students as a resource, one using other sorts of consultants in a way. I'm wondering if you can talk a little bit about how you think about staffing and building up expertise or finding clusters of expertise as you think about scale across municipalities. I understand that there's probably common themes that emerge in projects that you work with in different regions. And so are there things that you do internally or structurally within your organizations to allow for the best cross-pollination?
Yeah, I think that's a great question. I can go ahead and answer first. I think for us, now that we've been up and running for a couple of years, we are seeing that there are some similar questions and requests that we keep getting in from communities one after the other. So I think in that sense, it's really important for us to think about creating some spaces for municipal partners to maybe learn from each other and collaborate from each other around what they're learning from us. Maybe we can share a student project that we did for one community with a different community, and there can be some applicable learnings there. But yeah, I think, as we continue to scale, thinking about what are the common threads in terms of questions we keep getting, making sure we have faculty that are able to help answer those questions. And then also, again, just creating spaces for communities to share directly with one another.
Yeah, it is. It's a great question. It's and I think it is one thing we've found is, especially in the smaller or lower income, lower budget municipalities that are just not going to be able to afford the breadth and depth of professional management that larger and municipalities with larger resources can afford. And so, I think, by aggregating, as we have a bunch of retired folks who've, just to pick one, financial forecasting, we've been doing a ton of financial forecast work lately. And we have a team of folks that did it for their whole careers and can now help out just for this small piece, municipalities that might be struggling to do that on their own, because they may have great people, they may have smart people, but they're also so overextended right now, and they may just not have as many years of service and as years of expertise dealing with prior crises as a sort of team that from the outside. So for a lot of things where you don't need, a long-term full-time benefited person, but you need a little bit of expertise for a quick hit. Models like ours and Emily's, I think, are critical at this point. So.
Excellent, that's great. I think maybe to shift into the topic on everyone's mind, and I know many of you left some room to continue to expound on your projects as it relates to COVID-19. Question for Min, I was struck by the network analysis picture that you shared. Maybe would have not been as familiar to some people until COVID-19 hit. And I think we're thinking a lot more about how different connections between people can result, in this case, in an infectious disease. But I kind of wanted to talk to you about the flip side of that, which is we see the impacts of human connection now on something that's scary like COVID-19, but what are you seeing sort of on the underbelly of that? How can the connections that you've fostered, whether looking at racial equity or looking at mental health, how can they strengthen a community's response or be there for a community, for a set of stakeholders as they're I think hoping to be resilient or finding resilience in the face of COVID-19?
Sure, I have some examples. Yeah, I definitely think that systems and network thinking are going to be a huge part of this in moving forward. I just attended a network innovation summit that was hosted in Denver, where people from all over the country were sharing about how networks are playing a role and how they're addressing and understanding COVID. And I think from a agency perspective, it was the executive director of the Colorado Department of Public Health, I think, who was talking about how partnerships are really going to be a force multiplier for them, especially in emergency response, and hopefully making government more nimble in the way it can respond. And then I found really interesting at the individual level when thinking about resilience. There was another it was the Bill and Melinda Gates Foundation that was looking at how the education sector is responding to COVID and how a lot of the focus tends to centralize on academics. But when you look at individuals' networks and how they can support, students' relationships and their networks, being equally important in how they get through the moment and get through future moments that are similar, can really help them work through it. And that's that kind of framing really is important in thinking about how the systems prioritize how they respond and support individuals.
Excellent. A question for Emily. Given you talked earlier about the need to frame questions in the context of research questions, and it's one of the directives that you give to the partners that you work with in municipalities. I'm wondering if you have begun to anticipate the types of research questions that either that you're already seeing or that you will see as the direct COVID-19 crisis or the related crises related to fiscal stress or related to higher unemployment or whatever the issues might be. Have you started to think about what those are and anticipate them, work with faculty? And if so, can you talk a bit about that?
Absolutely. Yeah, no, we have started to think about that. And I think for us, the first piece of it was really sort of tracking what we have been hearing cities, mayors, town managers say that they're focused on around how they need to respond and recover to COVID-19. And I think it's probably going to be questions coming in a few different phases. I think there's these immediate questions around all things public health, how to help fill, capacity gaps at health departments, anything related to ways that we can isolate safely. How do you reopen safely? Things like that. So I think there's sort of like, those are the immediate questions. And then I think that there's going to be a focus, somewhat unfortunately, just on economic recovery. And small business recovery. I think small businesses, as everybody knows, are taking a huge hit right now. So, we anticipate that a potential research question may be, where did the PPP federal funding go in my community? How was it distributed? Was it distributed equitably? And things along those lines, as well as, a longer term need for things around planning for how to respond, looking into fiscal year 2022 and how that impacts your budget, how that impacts personnel, how that impacts operations. But one thing that I think we also have been thinking about how we can leverage MetroBridge and experiential learning with is there's going to be a lot of things at cities and towns that aren't going to happen in the next few years because of these budget cuts, whether that is a focus on arts and culture or the environment. So we're trying to anticipate what are going to be the research needs in those areas. And then lastly, one kind of interesting area that our team at IOC has talked about a lot is just, again, kind of how are we using and supporting the arts during this time? Especially, how can that maybe be a tool for helping with public grieving? So there's, both the practical questions that are happening now, and I think the longer term questions around budgeting and planning, and then also questions around, what isn't going to be happening, what's getting cut, and how can students help fill those gaps.
Excellent, thank you. A question, Mike, for you. You use the very scientific parameters of things are going to be bad to very devastating, I think were your words. I'm wondering if you could talk about what decides if it's bad or devastating. You also talked about how the impact might be this moment. I guess we're about to enter a new fiscal year for most municipalities, but I think if the lessons from the 2008 crisis suggested that there's even situations where there's 2-year fiscal lags. I wonder if you could just talk about what you'd anticipate to the best of your ability to see, to project forward what might happen.
Sure. Yeah, and it's it's interesting. I mean, interesting in a sad way that the way this is going to the sort of mechanism by which the current crisis is going to impact the finances of different municipalities is going to depend a lot on their particular situation. So you look at one that pick one that gets 60% of its operating budget from state aid, if you're looking at, we're hearing up to a 20% cut potentially next year in state aid. That is for a municipality getting 60% of their budget from state aid and taking a 20% cut of that in and of itself, forgetting anything else, is a huge impact. Then you have those that, have been, growing rapidly. And so their budgets have been based around new growth numbers and the anticipated increases. You have those, you have to take into account the balance between residential and commercial property taxes and how the time lag of the impact of the revaluations is going to, it will hit the different types in different ways. Some municipalities have huge local receipts, hotel, motel, things like that, while others have virtually none. And so all of these things, some have been limping on year to year, basically filling gaps in their operating budget with one-time revenues based on what's called free cash, which is money from the prior year. Well, if you've been doing that and all of a sudden you have nothing left from the prior year because of this year, that's going to really hit a lot of places hard. And then, so I guess, there's going to be a lot of pain, but it's going to come through different channels for different places. Some are feeling it already. You've starting to see the first rounds of furloughs and layoffs, but some at the moment, you can't really see it yet, because it's going to take more time to work its way through, but the damage is still coming. So it's, as you're saying, it could be a lag in some places, as we saw in the last crisis.
Excellent. Great. Well, we're close to time. We're going to kind of do a last quick fire round with the panelists, and they haven't heard these questions before, I promise. So we just came up with the idea of doing a quick fire. So the question framework is this: I'm going to ask if you're optimistic or pessimistic about something, and just from each panelist, if you could just share whether you're optimistic and pessimistic, and maybe a sentence or two about why. And I'm going to start with evidence-based policy. And I think this is, by the way, in light of the COVID-19 crisis and sort of how we emerge over the course of the next couple of years. And so the first person can just jump in.
I'm optimistic. I think it's needed now more than ever. We really need to be driving solutions that are based on evidence and data.
All right, I'll play devil's advocate and say pessimistic, because the key will be in the implementation, and as the financial chaos works its way through, it makes implementation of anything that much harder.
Yeah, you're on mute. Yeah.
I'm an evaluator, so I have to stay optimistic about that. Yeah, I think I agree with Emily that it's important now more than ever.
Great. Civic engagement.
One thing we've seen, I've heard over and over, is municipalities that never had, boards and committees that never had any attendance, and all of a sudden you put it on Zoom or another video conference, and they actually have people attending. So I'll throw one in the optimistic for civic engagement.
I have to agree. I think I have to feel optimistic around civic engagement. I think as people are sitting at home, I think a lot of folks are just really interested in actually getting out and getting engaged again. And I think, to Mike's point, that going through this public health crisis has really made people more aware of the role of local government and communities in keeping themselves safe and healthy. So I think that they want to have a voice in that.
Great. And then the final one, which I think is already a much debated topic, certainly among sort of the urban planning community and certainly of interest to people on this call, but how do you feel about the future of cities, and sort of wrapped up into that real estate in cities, which had been increasing probably on a 10-year run and without much stoppage, young people moving to cities, public transit, everything that sort of had defined cities that is kind of seriously challenged by the current crisis. I wasn't trying to lead you to water. I'll close by telling you whether I'm optimistic or pessimistic.
That's $1 million question, I think. I think if we can figure out a way to make all the things that you mentioned feel safe again, I think especially public transportation, I do feel optimistic, but I think we're a long way from getting there. So short-term pessimism, long-term optimism for me.
I'm inclined to say pessimistic, definitely for the short term, for the same reasons, thinking about transportation and housing, and yeah,
I would third all that. It makes me think of a quote from the former mayor of a Brazilian city of Curitiba, who used to say, the city isn't the problem, the city is the solution. And I think in the long term that will still hold true, but the short term is going to be a challenge.
Okay, well, I'll vote for optimistic just because everyone else voted for pessimistic. But I think my answer would be a couple of different angles. One is maybe a trial run for some of the more serious issues we'll deal with around climate change, or even trial runs around more serious pandemics that could be faced going forward, and kind of mobilizing a combination, hopefully, of public health infrastructure with research and innovation, and maybe a set of more resilient public services. So with that, I'll turn it back over to Dan, and really appreciate the panelists for joining, and all the audience members for participating.
All right, thank you, everybody. Thank you, Emily, Mike, Min, for those great talks. Thank you, Ben, for the great conversation and for the closing provocative questions. And thank you for not asking me that question and making me answer that in front of everybody. Although I'm going to strike, as per my job, an optimistic note here. I think that, we had a piece in Globe Ideas a couple weeks ago to this effect, and Marty Meehan had an essay this morning, I think it was posted this morning, an editorial on this, that, it is a challenge ahead of us, but the engagement of the research sector to try to help build the necessary innovations, I think that no city is better situated for that than Boston. And I don't want to sound too much like a booster, but I think that that's true, at least to some extent. And so I think that it's a call for this community to really help out and figure out how we rebuild urban life in the image that we want it to be. So with that inevitable plug for the conference, I want to thank the panelists again. Thank you, Ben, and thank you to our attendees. This doesn't happen without you. And so we are going to switch over to the happy hour. It takes us just a couple minutes, but we'll be there in just a moment. It is bit.ly/BARI happy. You will have a password. The password is BARI, capital BARI. It should have been posted in the Q&A as well, that bit.ly link. So we will see anyone who wants to join us there shortly. Thank you again, and have a great weekend.
Thank you.
Thanks.